Welcome back to Good Morning Arkansas. I'm Justin Lewis filling in for Chris Kane, and we're joined by Dr. Devlin. He's here to tell us about a cosmetic procedure for men that's becoming very popular. Now, we talk about cosmetic procedures, you probably think women immediately, right? But men are having things done, right?
A lot more men are starting to have cosmetic procedures done, and one of the ones that we're seeing a big increase in is breast surgery for men. People might think that's kind of odd because you think of breast enlargement, but this is actually the reverse of this. This is actually reducing male breast. So we're talking about gynecomastia. Gynecomastia is basically enlarged breast tissue in men, and you see that about 30% of the population is actually affected with this.
So 30%, that's a pretty large number. Do guys know this is going on?
Well, the guys don't really know because most guys kind of hide that and they don't really see other people do it. They'll wear compression vests. They won't take their shirts off. So most people, when you tell them it's 30%, they think they're the only ones that are involved. Now they're starting to get on the internet, a lot more access to information. They're starting to realize that it's not just them, and they're looking at what can I do about this.
What kind of psychological effects is it having in some of our guys?
Oh, that's funny. I just had a man come in about a couple of weeks ago, and during the consult, we were doing a physical exam. He's taking his shirt off, and he told me, "This is the first time I've had my shirt off in front of another human being in over 20 years." That's pretty profound. That shows you just the depth of kind of the embarrassment or shame that they feel with the enlarged breasts. And now they're just wondering. And after the procedure, they're like, "I should have done this a long time ago," because it really boosts their self-confidence.
Dr. Devlin, I wonder what is causing this? I guess if people have this going on, what's happening in their bodies?
Well, there's a lot of different causes for enlargement in breast. Most infants, 90% of infants, male infants, are going to have enlarged breasts, and that's just to do with an imbalance between the female hormones and the male hormones, and then that usually resolves on its own. Then you see another distribution of it during puberty, where again the hormone balances are kind of out of balance, and you can see that in up to 50 to 60% of teenagers will develop that. Most of those go on to resolve within 6 months to a couple years, but about 20% of those still are around, and those are the ones that are going to persist.
And for guys that are coming in, like the one you gave me an example of that have this going on, how do you kind of fix that problem?
Well, number one, we look at what is the cause of it. Is it just a true enlargement of the breast tissue, or is it just fatty deposits in the breast tissue itself? Sometimes it's medications. A lot of times, depending on what medication can do it. Interesting enough, the big thing in the news now is low testosterone, and so they'll do testosterone replacement. Interestingly enough, most of the time that does correct things, but one of the side effects of that can cause enlarged male breast. Other things are certain blood pressure medication can do it. One of the big ones is the stomach acid medications like Tagamet, that type of thing, that can cause enlarged breast. And one of the other big ones is, certain drugs like anabolic steroids that people will take for weightlifting. A lot of times we'll see patients that come in who've had a history of taking the anabolic steroids. Alcohol use, marijuana, those type of things can also cause enlarged breast.
When we're talking about enlarged breasts and I guess trying to reduce that in men, are there other cosmetic procedures that we're seeing kind of guys having done now?
Men are starting to have a lot more cosmetic procedures, fillers, Botox, especially the non-surgical ones, liposuction for just some contouring. We're seeing a lot more older gentlemen come in to have their eyelids done, a little bit of a facelift, that type of thing. It's becoming a lot more socially acceptable in females, and so the men are just kind of starting to pick up on that and do that themselves.
Maybe trying to, I guess, catch up and also stay attractive. You seem like that's why women do it. Is that why guys are starting to do it?
Self-confidence is really the big thing. They're really just kind of boost their, and that's why, especially with this procedure, with the gynecomastia, the surgery itself is really not a bad surgery. Usually we treat that with either just surgical excision or a combination of the surgical excision and liposuction, outpatient surgery, an hour to 2 hours to do, and they're home, and there's really not a whole lot of downtime. So.
Okay, well, Dr. Devlin, we sure are glad
Did we get to see a before and after picture at all?
Do we have that picture up? Yeah, there we go.
You see this is your typical presentation right here, where you see an enlarged male breast, and then here's one after surgery, and you can see it really does
quite a difference.
Big difference, and a big psychological.
And that's simply surgery. That's not any sort of diet or anything, right?
That's not diet, because if it truly is glandular hypertrophy, that breast tissue is enlarged, diet's not going to take care of it. Surgical excision is a treatment.
That's a good example there, Doctor. Well, thanks for coming in. It was good to see you. And this is Devlin Cosmetic Surgery. If you want a consultation, you can reach them at 227-8811 or drdevlin.com. After the break, we'll have some look at your entertainment headlines.